Welcome again to the Dr. Ridwan Show, health information you can use. We are in the show episode of hypogonadism or low testosterone, and we are with our guest experts, the urologist, Dr. Ajay Nehra, and the family practitioner, Dr. Matt Rosenberg. So we learned about testosterone deficiency, we learned about its symptoms. What would happen if low testosterone is left untreated? If someone just goes on for years without treatment of low testosterone, is there harm associated with that? Is there an effect on life, on quality, on quantity of life? Share with us the knowledge about this.
That's a fabulous question. And we do know a lot of data on this. We know that patients in the lowest percentile of testosterone die younger of all-cause mortality, meaning for all reasons, than do patients who have normal testosterone. And that's a little scary because we really need to understand this a little better.
I agree with what you said, Dr. Rosenberg. It is patients in the lower percentile. However, I think what patients need to understand is that they can be at a higher risk, and in particular, cardiac mortality is extremely important and something that's unrecognized both with the patient and their partner. Right. And that's something that does need to be addressed if a patient is truly hypogonadal.
Now you happen to be the leader of an important project that happened recently, which is the so-called Princeton 3 Consensus Conference. Could you enlighten us a little bit what that conference was about, who the experts who attended, and what it addressed, and how it relates to testosterone deficiency?
I was one of the leaders. The Princeton 3 has a huge legacy dating back to about 12 years now. And it's really a multidisciplinary, so you have primary care physicians, urologists, cardiologists, endocrinologists, and epidemiologists all pulled together to come together and approach a consensus that linked sexual health to cardiac disease, a consensus that went on to further explain how we should modify treatment strategies in order to prevent cardiac disease or treat these patients. And now, as you alluded to, Dr. Shopsik, you were part of this conference as well, where testosterone may be playing a much bigger impact in the overall schema of men's health.
As we learned from you, testosterone deficiency affects the quantity of life. It might affect and cause earlier death. But how about quality of life?
Well, as I see it, testosterone is part of the whole puzzle. You know, as we were just hearing about the Princeton guidelines and the cardiovascularists, we know that that's there, and it's very concerning. You know, we know these patients who are at risk for cardiovascular disease could be suffering from low testosterone. At the same time, there's that whole quality of life issue. They're going to be suffering from all the effects of what we like to think of their cardiometabolic problems. And when we say the cardiometabolic patient, this is your overweight patient, out of shape patient, has a lot of diseases, diabetes, heart disease, hypertension, lung disease.
So this is something very common.
These are very common, and testosterone plays a piece of this. So when we talk about the quality of life, how are they able to deal with the diseases that they have? Are they maximizing their benefits? Is the diabetic who is suffering from the diabetes themselves, are they also suffering from hypogonadism? And does treatment of the hypogonadism help them? You know, it's a puzzle that we're still trying to figure out. And then on top of it, the whole quality of life issues about sexual health. You know, if your testosterone is low, are you performing sexually to the point that makes you or your partner happy? And that's a personal decision.
So it is important to pay attention that if you have the symptoms of low testosterone, such as low sexual desire, such as other sexual dysfunctions, such as low energy, low motivation, weakness, difficulty concentrating, and you have some of those diseases that you mentioned, such as diabetes, obesity, cardiovascular disease, that you really need to pay attention to that and maybe have a conversation with your doctor about the possibility of having a blood test for testosterone and having a diagnosis of hypogonadism or low testosterone. So stay with us on the Dr. Ridwan Show, health information you can use for more information about testosterone deficiency and also how testosterone deficiency or low testosterone can be treated successfully, effectively, and safely. Stay on www.drridwan.com.